Okay, folks, get ready, because today we are taking a deep dive into the world of physiotherapy.
Ooh, physiotherapy.
Yes.
I like it.
We're going to be talking all about common injuries and the techniques that they use to rehab them.
Okay.
And you know how understanding all of this can actually help you move better and maybe avoid having to go see one in the first place,
Yeah,
right?
makes sense.
So let's face it, I mean,
Yeah.
who hasn't tweaked their back picking up something they shouldn't have?
Oh, yeah.
Or felt a twinge in their knee after, doing something they shouldn't have.
Oh, for sure. Yeah, especially as we get older.
Yeah.
Right?
Yeah, like weekend warrior stuff.
Yeah, those weekend warriors getting out there and, thinking they're 20 again.
Exactly.
And then Monday rolls around.
Yeah, you're like, oh.
And the body's like, no,
Yeah.
you're 40. You're 50. So
You got to take it easy. You'd be surprised how many people I think I've talked to where they think that physiotherapy is only for hardcore athletes or people with really serious injuries.
yeah, a lot of people think that.
Yeah.
For the elite athletes or people who've had, a really serious accident or something.
Right.
But the reality is physiotherapy can benefit pretty much everyone.
Yeah.
Whether you're dealing with chronic pain,
Right.
recovering from surgery, or just want to, improve your overall mobility
Right.
and how your body functions.
Yeah, it's like preventative maintenance too.
Absolutely.
Just understanding how your body works can help prevent those things in the first place.
Totally.
So let's jump right into it and talk about some of the common injuries.
Okay, let's do it.
We see that pop up all the time.
Okay.
Like back pain, for instance.
Back pain.
Seems like a universal experience.
Right.
Pretty much everyone has back pain at some point.
At some point in their life.
What's the deal with our backs?
Well, it's interesting because our backs are, they're so important for, our structure and our movement,
Yeah.
but they're also incredibly vulnerable to injury.
Right.
And a lot of times it's the little things we do every day that contribute to back pain. Like you mentioned,
Yeah.
slouching at our desks,
Yeah.
lifting heavy things incorrectly.
Using our back instead of our leg.
Exactly. Yeah. Not engaging those core muscles.
Yeah.
And even stress, believe it or not.
Oh, really?
Yeah. Stress can really tighten up those back muscles and
Okay.
lead to pain.
So my mom was right. Posture does matter.
Yes.
Okay. I'll tell her you said that.
Absolutely. Good posture is so important.
Now I got to ask about neck pain too.
Neck pain. Oh, boy.
Yeah.
Another big one.
It feels like everyone I know is complaining about tech neck these days.
Tech neck, it's a real
Is that a real thing or is that just something we made up?
It is absolutely a real thing.
Like-
We're spending so much time looking down at our phones or laptops or tablets. Our heads are constantly jutting forward.
Right.
And that puts a lot of strain on the muscles and joints in your neck.
I can feel it.
Right.
Yeah. Just thinking about it, I'm like, ooh.
But it's not just tech neck.
Okay.
There are other things that can contribute to neck pain.
Okay.
Whiplash from a car accident is a big one.
Right.
Even just sleeping in an awkward position
Yeah.
can throw your neck out of whack.
Yeah. So note to self, get a better pillow.
Exactly.
Yeah.
A good supportive pillow can make a big difference.
All right. Speaking of things that can really sideline you,
Oh, yeah.
let's talk about knee injuries.
Knee injuries. Oh, boy, those are scary.
Yeah.
Especially for, people who like to stay active.
Yeah.
Like to run, like to play sports.
Yeah. You hear about athletes all the time
All the time.
getting knee injuries.
Yeah, and there's a lot of different types of knee injuries,
Yeah.
but some of the most common ones involve the ligaments and the tendons that help stabilize the knee joint.
So what kind of damage are we talking about there?
Well, one of the most common that we see is an ACL tear.
ACL tear.
The ACL stands for anterior cruciate ligament,
Okay.
and it's one of the major ligaments that helps stabilize the knee.
Got it.
Now, sudden twisting or pivoting motions, those are really common in sports, can cause that ACL to tear.
Ouch. That sounds painful.
It can be very painful, and it often requires surgery.
Wow.
Yeah.
So is that the only thing? Or
No, you also have the meniscus,
meniscus.
which is basically like a shock absorber in your knee,
Okay.
and that can get torn or injured as well.
So that's basically like cushioning.
Exactly. Yeah, it helps to cushion the joint and distribute the load evenly.
So basically knees are both amazing
They are?
and incredibly vulnerable at the same time.
Yeah, they really are.
We've got the back, the neck, the knees. Let's head up to the shoulders now.
Shoulders.
What brings people in for shoulder issues?
Shoulders are another area that we see a lot of problems with. And one of the most common culprits is a rotator cuff injury.
A rotator cuff. Okay.
Now, the rotator cuff is a group of muscles and tendons
Okay.
that surround the shoulder joint.
Okay.
And they basically act like a support system.
Keeping it stable.
Exactly.
Got it.
But if you do a lot of repetitive overhead motions,
Like what kind of motions are we talking?
like throwing a baseball,
Okay.
swimming,
Yeah.
even painting a ceiling,
Interesting.
those muscles and tendons can get overworked and inflamed.
Okay.
And in some cases, they can even tear.
So it's a lot of like wear and tear.
Yeah, a lot of wear and tear, especially if you're not careful.
So we've seen now how easily these areas can be injured.
Yeah, we put our bodies through a lot.
We do.
Right.
So let's say you do end up needing some help.
Okay.
What actually happens when you walk into a physiotherapy clinic?
All right, so you walk into the clinic,
Yeah.
and the first thing you're going to do is meet with the physiotherapist.
Okay.
And they're going to do a thorough assessment.
Okay, so they're not just going to be like, lie down on the table, we're going to do this thing.
No, no, no. It's not like that at all. It's
Right.
much more personalized than that.
Okay.
So the assessment is really important because it helps the physiotherapist to understand the root cause of your pain or your limited movement.
So they're not just treating the symptoms, they're trying to figure out what's actually causing the problem.
Exactly. It's like detective work.
I like that.
Right.
The detective analogy.
You're trying to figure out what's going on.
Yeah.
Why are you experiencing this pain?
Instead of just slapping a Band-Aid on it.
Exactly.
So once they've done their little detective work,
Yes.
what happens next?
Well, once they understand the source of the issue,
Yeah.
they can create a personalized treatment plan for you.
Okay, so it's not just like a one-size-fits-all.
No, not at all. Everyone's body is different.
Right.
Every injury is different.
So the treatment plan.
It's going to be tailored specifically to you.
Okay, and what does that usually involve?
Well, it usually involves a lot of active participation from the patient.
Okay, so you're not just lying there passively.
No, you're actively involved in your recovery.
Okay.
So the treatment plan can include specific exercises to strengthen the muscles around the injury,
Okay.
to improve flexibility, to regain your full range of motion.
So it's a team effort.
Absolutely.
The physiotherapist is guiding you,
Guiding you.
but you're really in the driver's seat
You're in control.
of your own recovery.
Exactly.
And so what are some of those like techniques that they might use?
Well, there are a lot of different techniques,
Okay.
but some of the common ones include manual therapy.
Okay, what is manual therapy?
So manual therapy is where the physiotherapist uses their hands
Okay.
to mobilize joints or to release muscle tension.
So it's like massage.
It can be like massage.
Okay.
It can also involve things like stretching,
All right.
joint manipulation.
Interesting.
So it's very hands-on. Very hands-on.
And then they might also use other modalities like
Yes. So in addition to the manual therapy,
Okay.
they might use things like ultrasound
ultrasound.
or electrical stimulation.
Okay, those sound pretty high tech.
They can be.
So can you break down like what's actually happening there? For
Sure.
example, like how does ultrasound help the body heal?
So with ultrasound therapy, we're basically using sound waves
Ways.
to generate gentle heat deep within the tissues.
Okay, so it's not like the ultrasound you get when you're pregnant.
No, it's not like that at all. It's a
Oh.
different type of ultrasound.
Okay.
But basically, think of it like a mini massage
Okay.
for your muscles and your tendons
Using sound.
using sound waves.
Okay.
And that increase in heat brings in more blood flow,
Okay.
which helps to reduce inflammation
Got it.
and speed up the healing process.
So it's kind of like tricking your body into healing faster.
In a way, yes.
That's really interesting.
Yeah, it's a very effective treatment.
What about those therapeutic exercises?
Okay, so therapeutic exercises,
Yeah.
those are really important
Okay.
because they help to strengthen the muscles,
Yeah.
improve your range of motion,
Right.
and help you regain your functional abilities.
So what might that look like for someone who's rehabbing like a knee injury,
Okay, so let's say someone is recovering from a meniscus tear.
meniscus tear?
Yeah, so in the early stages,
Yeah.
we would probably start with some gentle range of motion exercises.
Okay. What would those look like?
Things like heel slides or simple knee extensions,
Okay.
just to get the joint moving.
Without putting too much stress on it.
Exactly.
Okay.
And then as they progress,
Yeah.
we would gradually introduce exercises to strengthen the muscles surrounding the knee.
Okay.
So things like squats, lunges,
Okay.
things like that.
So it's very gradual.
Very gradual. We don't want to overdo it.
So it's like a carefully choreographed dance.
It is.
Of slowly rebuilding strength and mobility.
Yes, exactly.
That's great.
So it's important to listen to your body
Yeah.
and to follow the guidance of your physiotherapist.
Right.
Don't try to push yourself too hard too soon.
Yeah. Don't be a hero.
No heroes in physiotherapy.
What would be your number one piece of advice for someone starting physiotherapy?
My number one piece of advice
Yeah.
would be to be an active participant in your recovery.
What does that mean?
It means ask questions.
Okay.
Make sure you understand the exercises that your physiotherapist is giving you
Yeah.
and do your home exercises.
Okay.
Make those a non-negotiable part of your routine.
So it's not just like you go to the clinic and you do your
No,
thing.
you have to do the work at home too.
Even if it's only like 15, 20 minutes?
Even 10 minutes.
Okay.
Every little bit helps.
All right. That's great advice.
Thank you.
Physiotherapy really is about so much more than just fixing injuries.
It is.
It's about understanding how to move better and prevent those injuries
Absolutely.
from happening in the first place.
Prevention is key.
So as we wrap up here,
Okay.
here's something to ponder.
All right, I'm ready.
Think about how much we rely on our bodies to do well everything.
Yeah.
What small steps can you take today to improve your physical well-being? Maybe even avoid that trip to the physio altogether.
Good question.
Until next time, keep learning
Yes.
and take care of yourself.
Take care.
Hey,
Everyone.
see you next time.
See ya.